Welcome to the Going Viral for Health, using social media for marketing, advocacy, and action general session. I'm Dudley Brown, Director of Communications at Wofford College. I'm also a member of the Eat Smart, Move More South Carolina Board of Directors. Social media is a great way to increase awareness of your organization and its work. During this session, you're going to learn how social media marketing strategies can create trust among your audience, new followers, increase health awareness, encourage health improvements in rural areas, engage people in healthy activities, and showcase community members committed to health. Today's speakers are from Clemson University. They are Jamelia Graham, Sarah Griffin, Samuel Baxter, Michelle Parisi, and Caitlin Koob. I hope you enjoy learning more about social media marketing to create healthier communities.
Good afternoon, everyone, and welcome to Going Viral for Health, using social media for marketing, advocacy, and action. My name is Jamelia Graham, and I have the pleasure of serving Hampton County as their Clemson Extension Rural Health Agent.
And my name is Caitlin Koob. I'm an occupational therapist and also a doctoral student in the Applied Health Research and Evaluation program in Clemson's Department of Public Health Sciences.
We are so excited to have you all here today. We want to thank our co-PIs, Dr. Parisi and Dr. Griffin. We would also like to thank our postdoctoral fellow, Dr. Samuel Baxter, and our colleagues across the state that are doing this work. So before we get started, I wanted to give a little bit of background about what Clemson Extension is. Clemson University is a land-grant university, meaning that they focus on a triple aim approach to their university philosophy. So they focus on education, research, and then that third aim is focused on extension. So applying the education and the research that is on the university level and disseminating it to counties across the state. And we do this by delivering unbiased research-based information and education. Because this is a session all about social media, we do ask that you like us on Facebook. And don't worry because some of the names are very lengthy, don't worry if you can't get all the names. You will see our tags at the end of the session. So I'm going to turn it over to Caitlin, who's going to talk a little bit more about health communication.
Yes, thank you. So health communication is pivotal to bridging the gap between what we do in the research field at Clemson University, and then also how we bring it to the public through the programs that we offer and just what we're doing in the communities. And so with that, we've provided some components of health communication that help us make sure that what we're doing and the messaging we're putting out into the public is helping to increase the understanding of the importance of the cause at hand and understanding the goal of the messaging among the intended audience. So with that, knowing the goal of the message is extremely important when providing health communication information. We must understand the theories, models, and the underlying components that contribute to the overall goal when developing effective communication strategies. So at Clemson, within the High Obesity Prevention Project, we're focusing on obesity prevention. So we have broken this down into nutrition, physical activity, and advocacy posts, which are include walkability and active transportation posts so that we can advocate for healthier communities within those three components. It's also important to know your intended audience. So with that, being sure that you can develop intentional messaging that will be relevant to them and that can be understood. And this goes into using research-based strategies to create materials, including exploring social and digital media options such as relevant to your audience. So for us, we've used Facebook as our primary method of promoting health communication, and also spreading the word and attracting attention and publicity towards your efforts. So finding ways to attract attention through community events and social media campaigns. For us, this has included appropriate hashtags and tagging relevant accounts in our posts. and then also using that to monitor success by tracking insights. So we'll go into this more in depth in the next few slides, but focusing on likes, reach, and engagement, and adjusting those as needed to make sure that we're reaching the most amount of people that we can and sharing our message across the counties that we're working in. So with that, the Facebook page has been extremely helpful for the High Obesity Prevention Project at Clemson in connecting with local community members from an organization level to an individual level. And so this provides us the opportunity to promote healthy eating, physical activity, and community well-being, but also provides a unique platform for local community members to connect with us as well as an organization. So we are mindful to provide health communication that is easy to digest and can be understood so that it can be implemented in daily life. Some of the strategies that we've used are providing easy to read captions, primarily those at a 6th grade level, reading level, so that they're easy to read, understand, and implement in daily life. Providing relatable photos of individuals that are smiling or people together, photos that include people who look like a place or a person that might be performing the activity in the county where it's being posted. So for example, the post on the screen, you'll see 2 people who are wearing masks and further apart due to social distancing, but also participating in physical activity and spending time together. We also use consistent formatting. So you'll see the same logos, borders, and titles in similar spots on each of our posts so that they're easily identified as posts that are presented by Clemson through the High Obesity Prevention Project. And we also have colors correlated to our topics. So these orange posts, like you'll see here on the slide, are relevant to physical activity, but then we also have purple posts for nutrition and green posts for community advocacy. And as I mentioned before, we boost our reach through hashtags, including hashtag Hop for Health, which is our program's hashtag, and hashtag Active People. We also tag the Clemson Extension accounts in each of our posts so that the more people who see those can be more engaged and spread the word. So on this slide, we'll go a little bit more into the reach of our posts, specifically in Q1 of 2021. So you'll see that the number of people who see the posts come across their screen on Facebook is considered the reach. So in Lee County, there's an average of 25 to 30 people who consistently see each of their posts. And then in Marion, it's a little bit lower, but they also have lower followers. And Hampton County, with the most followers, has the higher number of reach. So it's fairly relevant to the number of followers that are in the county, which is another reason why we like to find ways to increase our engagement so that we can gain more followers and so that more people see our messaging. You'll see also that some of the outliers were omitted from the reach calculations in the chart. And that is often because some of the posts that are more prevalent to the community or more important, such as chronic disease and health history in these posts, were found to have higher engagement. And so those reach numbers are higher than the average and would skew the data that way. But it's interesting to see that chronic disease and health history, as well as community gardens, which has been a big push in a lot of these communities, attract more engagement, and then therefore more people see them on their screens. And you'll also see that more when we post about local people that are highlighted as quarterly community champions, their reach is exponentially increased, and we'll go more into this later. So the tools that we've primarily used to promote our health communication are the university standards at Clemson that just make sure that we're matching their branding standards and portraying communication strategies that are parallel to Clemson's messaging and who Clemson is. We also use Adobe Spark for all of our Facebook posts, and we use Canva and Mailchimp as well within Clemson Extension. So the university standards at Clemson, you can see that they are based on who Clemson is and what they stand for. And we want to make sure that what we're posting is portraying that message from Clemson. So in our post, you'll see purple and orange colors in each of them. You'll also see consistent formatting so that they it is evident that our posts are coming from Clemson. And Clemson is focused on having smiling faces and people that are enjoying themselves and moving towards the goals of our project, as far as living active, healthy lifestyles and eating healthy as well, through the pictures that we post under Clemson's name. Just making sure that Clemson's spirit and voice is represented through our posts. So Adobe Spark is part of the Adobe Acrobat package, which has been extremely helpful as it's provided by Clemson University to students and faculty free of charge. And you'll see that this is what we use for our consistent formatting. We've actually been able to create templates for nutrition, physical activity, and advocacy posts, and so that we can consistently use those throughout our messaging. It's similar to Canva in that there are multiple templates for your needs, whether it's infographics or social media posts, and there are also multiple graphics available without need for citing. So this has been extremely helpful in promoting effective messaging for our project.
So as Caitlin said, Adobe Spark is very similar to Canva. And so we do use Canva on a pretty regular basis. And I'd like to focus your attention to the graphic on the left and the graphic on the right, specifically because the Canva projects really showcase some of our co-branding efforts that we have within the extension community and then within the communities that we work in. So the one on the left was a multidisciplinary extension team collaboration between the Rural Health and Nutrition team and 4-H and their Mighty Masks campaign that took place at the start of the pandemic. So 4-H was encouraging their club members to sew masks for those who could not find them or did not have the means to go and get one. And at the same time, I was creating a cloth mask safety post that was going to be put on our Facebook page to make sure that people were washing their masks frequently, that they were wearing them appropriately over the nose, mouth, and chin, and that they were, still washing their hands and social distancing. And so we ended up working together so that each person who received a 4-H mask also received this kind of postcard-sized information about how to make sure that they are keeping their mask on appropriately and staying safe. And the other part of that was we always cite our sources closer to the bottom of any post that we have that has some evidence-based knowledge. And so that's within the extension community. Outside of the extension community, we have the another graphic that focused on staying physically active during COVID-19. This was created truly to meet a need. One of the recreation directors was interested in starting up programming again. So we created this to make sure that people were maintaining social distance, washing their hands before and after they leave, and limiting contact with others. And as you can see at the very bottom, this is also co-branded. And the beautiful thing about co-branding is it is essentially a cosign. So in this particular model, this recreation director, by giving us permission to use her logo on this flyer, was saying, I agree with what Clemson is saying. We are going to try our best to follow the rules and make sure that everyone is staying as safe as possible.
So on this slide, you'll see some examples of Facebook posts that we have posted in the last 6 months or so, and how we use these posts to advocate and disseminate health education and promotion through our Facebook posts, and also through an appropriate reading level. And so you'll see, for example, the bottom right-hand corner might be a post where we would educate about portion sizes, and something that some people might not take notice of otherwise until being educated on them and the importance of them in obesity prevention. And then another part of our project is focusing on walkability and active transportation. So anytime there's someone who walks from point A to point B, whether it be from their home to church or to work, that's all considered active transportation. And so walking safely in your community might be another critical component that we might discuss and educate individuals on. through health awareness.
So now we're going to switch gears a little bit and talk more about health marketing. And before I get into this, I'd like to talk about how Clemson Extension traditionally marketed our programs and recruited participants. When you're a new agent and you're trying to make contacts, you want to talk with local leaders, you want to talk with community partners and stakeholders that really align with your interests. But due to COVID, we had to switch up our strategy quite a bit. And one of the ways that we did that, well, over the next 2 slides, we'll talk about 2 different ways that we market our programs with the public and how we market our programs with our community partners and stakeholders. So first, when we are dealing with when we were dealing with ways to market our programs, we turned to Mailchimp, which is an online platform that allows you to send emails to a large amount of people while also giving the email a little bit more pizzazz. It gives you a lot of good formatting options, a lot of ways to make it colorful and fun. And as you can see, as Caitlin said, we do like to keep with our Clemson Extension themes. So Clemson colors, we use specific fonts that are typically marketed towards Clemson Extension and Clemson University. So here's an example of a letter that was drafted by one of our other rural health agents, excuse me, who created a very clean way of showcasing all of the online programming that was available to people during COVID. And the wonderful thing about Mailchimp is not only the idea that you can have this really nice, clean, polished email, but you can also link it to other things. So this particular flyer here and here links to this image here. So this is a letter that was drafted that can be pretty much printed and posted wherever, has not only the programs that we offer, but it gives a little blurb. It tells you how to register and it tells you who to contact if you would like any additional information. And we found this a very helpful tool, and it has been used beyond just marketing. So now we're using it as we are corresponding with coalitions that we participate in or have leadership in, or as a programmatic email that gets sent. And we'll talk a little bit more about that in the next few slides. And so the other way that we kind of market to the residents in our counties is through Eventbrite. And Eventbrite is very common, but it was relatively new to Extension. And so here you see an example of it being used to promote a kitchen chemistry program, which was another multidisciplinary Extension team effort between FNEP, which is the Expanded Food and Nutrition Education Program, and Hampton County 4-H. So the beautiful thing about Eventbrite, beyond it being just a nice, clean way to market and register our participants, is that we can also get any sort of demographic information that we'd like. Parents or participants, they can pay for their child or themselves to participate in the program well before. And then also you can keep the registration open for as long as you need it to be. And that also helped to keep things a little bit more secure as we were going through giving out Zoom links and creating Zoom links for participants. So we found both of these methods, both Mailchimp and Eventbrite, very helpful as we were marketing our programs, getting people registered, and it also helped with it also helped with removing some of the clutter from having a lot of email attachments.
And now we'll move more into an advocacy focus. So on this slide, you'll see our marketing strategy for health advocacy. So advocacy is an activity or a message by an individual or group that aims to influence decisions and inspire actions, whether it's in a political, economic, or social circle. And so our advocacy posts in this context can be thought of as a call to action in the communities. And rather than informing people about a health topic, as we discussed in the health awareness slides, this calls on people viewing the post to take action in their lives in some way. And so you'll see in the first post that this is not an advocacy post. Rather, it's a health awareness post focused on a good night's sleep and the health benefits that are associated with it. While the second and third posts in green and purple are advocacy posts. So donating to a food pantry throughout the holidays to ensure that individuals in the community have food to eat, and advocating for healthier lunches for the children in the local communities can both be considered advocacy posts. And so in an effort to continue to promote action in the communities, we have begun doing quarterly community spotlights, which have been extremely helpful in highlighting people in the community whose active involvement aligns with our goals with the High Obesity Prevention Project, and showcases what they've been able to do. And so these are 2 posts from Hampton County where the reach is an average of 35 to 40 individuals who see each of these posts. But you can see the difference in reach and engagement as Ms. LaToya Thompson's post reached 2,267 people, with over 300 liking, commenting, and sharing on her post. And similarly, Mr. Jack Hutto's engagement in the community and involvement led to almost 2,000 people seeing his post, with over 400 likes, comments, and shares. And so here you can see that this is not only happening in Hampton County, this is also happening in Lee and Marion counties. So the top screenshot of the insights are what we see on the back end of our Facebook page. And so the yellow bar is showing how many people have seen the post, or how many individuals it's reached, while the purple and blue bars are showing the amount of engagements. So likes, comments, shares, and clicks on the posts. And so in Lee County on top, you can see the difference between an average post, which is reaches about 33 people, compared to a community champion post where it reached over 1,200 people. And on this day, the Facebook page also gained 11 followers. So these community champions have been extremely helpful in gaining more traction to our pages and giving us an opportunity to showcase what we're doing with Clemson and Clemson Extension and the CDC's High Obesity Prevention Project. And then below, you can see the same with Mr. Jack Hutto, as was shown on the previous slide, just showing the back end of what we can see here. So while the average post in Hampton County reaches approximately 35, 36 individuals, has reached over 2,000 with hundreds of likes, comments, and shares. And so now we'll move more into action, and Jamelia will share a few examples of what is going on in the community and how these things are being conveyed and involved with.
Okay, so I'm going to go through this a little quickly because we only have a few minutes before we're opening up the floor to questions. So one of the first ways that we really show our transition from health communication and health advocacy to action is by posting the events that our partners are involved in. And as you can see, these are bright, they're colorful, they're getting you very excited just by looking at them. And these are the sorts of things that we post on our Facebook page, not only to show that, not only to show where we are collaborating like you see in the center, but also to show that we support other community efforts too. Clemson Extension and Rural Health and Nutrition are not the only people with some skin in the game, as the saying goes. And so we do this to show just how many other things are taking place in the counties that we are working in. And then also we show our action through our programs. So this is Walk SC, and Walk SC is our 12-week virtual walking program with Clemson Extension. And so I had a cohort that was kind of linked in with the New Year's resolution time. So I leveraged people's New Year's resolutions and said, hey, you want to get a good jump start, join Walk SC. So these 2 particular posts promoting and recruiting for Walk SC reached over 4,000 people, had over 800 engagements, and that led to 245 people registering to participate in Walk SC. And what I really think is cool about it, here's a bit more of a breakdown towards who was joining, was that some of our participants ended up becoming advocates for Clemson Extension programs, particularly Walk SC. And so here's an example of one of our participants. This was not solicited. We did not know that she had created this post until we saw it on social media one day. And she really talks about how Clemson Extension's walking program helped to engage her a little bit more in her fitness journey. And so you kind of see that shift of just Clemson Extension advocating for its own programs and its own sort of philosophies towards health and physical activity, and that shifting to the community also doing that. And then we also have the food distributions, which are to have been taking place for a while, but our promotion of food distributions has really helped to engage not only the people who are partaking in these distributions, but to help those who are sponsoring and hosting these events to really show them that they can continue to be engaged. We've actually had two faith-based organizations in Hampton County who have decided to partake in a more permanent food distribution beyond what was provided at COVID. And then in Lee County, and this took place right before the pandemic began and we were quarantined, they started up the food share program. And it has been very successful thus far, especially because they can now accept SNAP and EBT. And then finally, we have the community gardens. And this is another way that we are identifying new food access points across the 3 counties that we work in, Hampton, Lee, and Marion. And so here on these photos, you can see the success that we've had with, almost sneezed, introducing raised beds to community places. So on the left, you see that this is through the Marion County Coordinating Council's Blueprint for Health grant, and this is their effort to creating a new food access point. And in Hampton County, we are working with Wade Hampton High School's JAG program, which is Jobs for American Graduates. And these students are really committed to creating a new health access point and a new food access point for not just their campus community, but the county at large. So these are just some examples of how we are taking the health communication posts that we're doing and the health advocacy posts that we're doing and really marketing it to the community at large. So with all of that being said, we would like to thank you for joining us today. Please, if you can, like us on Facebook. Once again, thank you to Drs. Parisi and Griffin and Dr. Baxter for your support throughout this entire few years of working on this project. We would now like to open up the floor for questions.
Okay, our first question. What challenges unique to rural communities have you faced implementing social media marketing and action, and how did you overcome them?
I think when you are engaging with a rural community, connectivity is always going to be your first kind of barrier to getting to the people through social media. I think when you are working with them to market your programs and to kind of display the good work that's going on, you also kind of have to rely on not just social media and not just flyers, but you also kind of have to that word of mouth. And so one of the ways that we combat this is we really try to engage with our community members through our posts. So some of our physical activity posts might talk about how walking is a social event and exercise is a social event. Grab your family, grab your friends, you all go out and take a walk together, or, do some sort of family-friendly activity that gets you up and gets you moving. And I think that's one of the main ways that we try to make sure that we're engaging with people beyond just that. So you're really kind of doing a call to action with some of our posts and the things that we say, um, moving into not just looking at what we're seeing and saying, oh, that's nice, but turning that into, okay, it's really nice. And now I'm going to tell my aunt or I'm going to tell my sister and we can do something together.
Yeah,
Okay.
and just to add to that briefly, Jamelia, I think the use of Facebook as a social media platform has been extremely helpful too. I've been to a few different conferences recently focused on communication and health education and promotion. And I think that a lot of people are focusing on podcasts and blogs and things of that nature. But in these rural communities, I'm not sure those would be as effective as Facebook. And as Jamelia shared, just the connectivity of the rural communities, we found that things such as the community champion posts and just bringing people together through mutual goals has really been helpful in increasing that engagement and making it more effective.
Okay, I'm gonna build on what you just mentioned, Caitlin, community champions. There's a question. How do you choose your community champions?
That's a great question. It's very difficult to choose a community champion. We have kind of a laundry list of people that we work with on a very, steady routine, and we think that their work is just awesome. So I want to say in Hampton County, at least, we have community champions for the rest of the year and the start of 2022. It's just all about kind of seeing who's really making an impact, small, large, or in between, that you can just give a little bit of an extra, there you go, you're doing awesome, you're doing great. I think that it's also important to ask the right questions to your community champions. So we kind of have 2 or 3 questions that we ask our community champions to expound upon, not just their work, but why they do it. And that why piece is kind of what helps set your community partners apart and your community advocates apart that you want to spotlight.
Wonderful. Next question. For a Facebook post targeted to older adults, what is the optimum font and font size? And then are Facebook posts accessible to screen readers?
That is a good question. I think our font size, I'm not sure of a particular number, but we do try to make sure that they are very easily readable. So aside from reading level, as I mentioned, trying to stay at a 6th grade reading level, also making sure that it's really clear and there's not a lot of clutter, so that it's maybe one sentence at the most, but that it's very clear to be read at the top, so that people who do need a larger screen and things like that, it's more accessible for them to read. The screen reader question is really interesting. That's not something that I have explored. I know there are screen readers for the captions of the post, but for the images themselves, I'm not sure. But that's a great insight that I'll definitely take a look into.
Last question. Who were or are your target audiences, and how important is it to use images that speak to or represent those audiences?
So overall, we'd like to target as many people within the county as we can. Sometimes we've branched outside of the county. I know that our Walk SC posts were seen by people in Marlborough County. So quite far from Hampton, but that's okay. I think as we were targeting our community, we wanted to make sure that we were creating content that was Hampton centric. And the same is said about Pete and Marion. We wanted to speak on and identify posts that were going to be relevant to their everyday life. And photos are a huge part of that. So we want to make sure that we're showing diverse faces in terms of race, in terms of genders, in terms of size, because we want to make sure that when people look at our posts and they see the photo specifically, because that's where the eye goes first, they say, that could be my mom, or that could be me, or that could be my child. And both of those are very important to do, making sure that we have content that's relevant to their everyday lives, and also that we have photos that can be applicable to any place in Hampton, Lee, or Marion.
Okay. Last question. What led you to the decision to utilize New Year's resolutions as the approach for the Walk SC program rather than a theoretical approach, such as the trans-theoretical model of behavior change?
One of the main reasons why I chose New Year's resolution was because I felt like when you start a New Year's resolution, no matter what it is, you have about a 6-week time period before you might kind of teeter off. And so with Walk SC being a 12-week commitment, around that 6-week mark when, participation's kind of teetering off, we could use social media, because another part of the Walk SC program is the Facebook engagement. So participants who are interested in joining the Facebook page may do so, and they can post pictures and all sorts of things. So I could use social media then to say, you're halfway there, don't give up, you're doing great, just to continue to incite that activity. And I felt like it was going to be a little bit longer lasting because we started at the new year.
Yeah, and I just want to add to that, Jamelia, as the communications and marketing manager at Eat Smart Move More, New Year's resolutions and other holidays or observances are fantastic ways to start a campaign, get people on board, get them, give them information and show that you are a trusted source. So kudos to you guys for choosing New Year's resolutions to start with this campaign.